Welcome back to our channel, everyone, to another episode of our English Learning Podcast. Today, John and I are going to talk about something very common and very useful in real life, visiting the doctor when you have the flu.
That's right. It's great to have you here with us today again. At some point, everyone gets sick, and knowing the right words in English will help you explain your symptoms, understand what the doctor says, and feel more confident in a hospital or clinic.
So, in today's episode, instead of listing vocabulary like a dictionary, we're going to take you through a simple story. We'll imagine a patient who isn't feeling well, goes to the doctor, and has a normal checkup. Along the way, we'll highlight and explain the important words and phrases.
Exactly. So, let's begin our story.
Imagine this. A man wakes up in the morning feeling very weak. His body aches, his head feels heavy, and he's coughing a lot. He thinks he has a fever.
Right away, we can pause here because we already have some useful words. When we say body aches, it means pain all over the body. People with the flu often say, "My body aches," or "I feel achy."
Yes, and when we talk about fever, it means the body temperature is higher than normal. Normally, the human body is about 37 degrees Celsius or 98.6 Fahrenheit. If it's higher, we say we have a fever.
And don't forget the word cough. If you keep making a sound like that's what we call coughing. Sometimes it's dry, meaning no mucus, and sometimes it's wet with mucus.
So already the patient has three main symptoms: body aches, fever, and cough. Those are very common words that the doctor will ask about later.
Now, the patient is worried because the fever isn't going away. He also feels very tired and his throat is sore. So he decides to go see a doctor.
Let's stop on sore throat. When your throat hurts when you swallow or talk, that's called a sore throat. Very useful expression because a sore throat is one of the most common flu symptoms.
So our patient thinks, I should visit the clinic. Notice we say clinic for a small medical office and hospital for a bigger place. In everyday English, both words are used. But if you just need to see a general doctor, you usually go to a clinic.
Right. So he makes an appointment. That's another useful word. An appointment is a fixed time to see the doctor. You don't just show up. You call first and say, "I'd like to make an appointment."
So at this stage, we already have more vocabulary. Sore throat, clinic, and appointment.
When the patient arrives at the clinic, the first thing he does is go to the reception desk. That's the place where the receptionist greets you, checks your details, and asks you to wait.
Yes, the receptionist might say, "What's your name?" Or, "Do you have an appointment?" Then she will tell the patient to sit in the waiting room.
The waiting room is the area with chairs where patients wait before seeing the doctor. You'll hear this phrase often: "Please wait in the waiting room."
And sometimes they ask for your insurance card. Insurance means a system where a company helps pay for your medical costs. In many countries, especially the US, the receptionist asks, "Do you have insurance?"
So far, the story is very realistic. Reception desk, waiting room, insurance. These are all words you'll definitely hear.
Now, the nurse comes out and calls the patient's name. The patient goes into the examination room. That's the room where the doctor will check you.
The doctor greets the patient and begins with a very common question: "What brings you in today?" That means, "Why are you here? What's the problem?"
The patient says, "I think I have the flu. I have a fever, sore throat, and cough."
Notice how natural that sounds. The patient lists the symptoms clearly. In English, you don't have to say too much, just the key symptoms.
The doctor might then ask,
How long have you been feeling this way? Time is important. The patient answers, for about 3 days.
At this point, we can explain symptoms. Symptoms are the signs that show you're sick, like fever, cough, sore throat, or body aches. Doctors always ask, "What are your symptoms?"
Perfect. And then the doctor continues with more detailed questions. For example, do you have chills? Chills are when your body shakes because you're cold, usually with a fever.
Or, do you feel nauseous? That means you feel like you might vomit or throw up. Nausea is the noun, nauseous is the adjective.
All of these are everyday medical words.
Now, the doctor says, let's check your vital signs. Vital signs are basic measurements of health: temperature, blood pressure, heart rate, and breathing rate.
For example, the nurse might put a thermometer under your tongue or on your forehead to check your temperature.
She might also use a blood pressure cuff. That's the band they wrap around your arm and squeeze to measure pressure.
And then the doctor uses a stethoscope, which is the tool doctors use to listen to your chest and breathing. He might say, take a deep breath in and out.
Exactly. That's a very typical scene in an English-speaking doctor's office.
The doctor might look inside the patient's throat with a small light and say, your throat is red and inflamed. Inflamed means swollen and irritated.
So by now, we've introduced more words: thermometer, blood pressure, stethoscope, inflamed.
After the examination, the doctor makes a diagnosis. Diagnosis means the decision about what illness the patient has.
In this story, the doctor says, it looks like you have the flu. Sometimes they also say influenza, but most people just say flu.
And the doctor might explain the flu is caused by a virus, not bacteria. That's another important distinction: virus and bacteria. A virus causes colds and flu. Bacteria cause infections like strep throat.
Which is why the doctor might say, you don't need antibiotics. Antibiotics are medicines that fight bacteria, not viruses. Many patients ask for antibiotics, but they don't work on the flu.
The doctor usually recommends rest and fluids. Rest means sleep and taking it easy. Fluids mean drinking water, juice, or soup to stay hydrated.
This is a very natural English advice. Get plenty of rest and drink lots of fluids.
Sometimes, if the symptoms are strong, the doctor may write a prescription. A prescription is an official note from the doctor that lets you buy special medicine at the pharmacy.
Yes, and the place where you get medicine is called a pharmacy or drugstore. In the US, you hear both words.
Common medicines for flu include pain relievers like ibuprofen or acetaminophen, which reduce fever and body aches. The doctor may also recommend cough syrup for coughing.
The patient might also receive lozenges. Lozenges are small tablets that you slowly dissolve in your mouth to help with sore throat.
And of course, the doctor will repeat, drink plenty of fluids and rest. That advice never changes.
The patient thanks the doctor, leaves the examination room, and goes back to the reception desk. The receptionist might say, would you like to schedule a follow-up appointment?
A follow-up means another visit later to check if you are getting better.
The patient says, no thank you. I'll come back if I don't feel better. Then he leaves the clinic with his prescription and goes to the pharmacy.
So, let's step back. We've walked through the full story of a patient with the flu. Feeling sick, making an appointment, visiting the clinic, talking with the doctor, getting examined, receiving treatment, and leaving.
And along the way, we learned the natural vocabulary, symptoms like fever, sore throat, cough, body aches, chills, nausea. Places like clinic, waiting room, reception desk, pharmacy, and medical words like diagnosis, prescription, antibiotics, stethoscope, inflamed.
More importantly, we didn't just list the words, we showed you how they are used in real-life situations. That way, you can imagine yourself in the same situation and know exactly what to say and what to expect.
And that's our goal, to help you not just memorize vocabulary, but truly understand how to use it in everyday English conversations.
If you ever travel, study, or live in an English-speaking country, this knowledge will be incredibly useful.
Exactly. Visiting the doctor is stressful enough, but if you know the words, you'll feel calmer and more confident.
That's all for today's episode. We hope you found this story helpful and easy to follow.
Thanks for joining us. Stay healthy, take care of yourselves, and we'll see you in the next episode. Don't forget to hit the subscribe, like, and share button.